And now it's my great privilege to introduce to you Professor Sergej Ostojic from Serbia. Professor Ostojic is actually one of the earliest pioneers in molecular hydrogen research in Europe. I think he started his research around 2011, 2012 or so. That's when I came across some of his first publications, and I had a lot of interest in getting to know him, which I later did. So I was able to go to Serbia, meet him in person, had several conversations. Then recently I was at his lab, and we were able to talk a lot about research, and we've collaborated a number of papers together, and I've really got to know him. And he's so dedicated to the molecular hydrogen research, understanding what its real clinical benefits are, and helping to advance this entire field. And I'm just really grateful for his activism, his support, his hard work, his dedication. His entire team is just so spectacular and wonderful. And now I will read his bio. Professor Sergej Ostojic earned his MD from the University of Belgrade in 1996 and a PhD in medical sciences in 2003. He completed further training at Mayo Clinic and Harvard. Currently, he is a professor of nutrition at the University of Agder Biomedical Sciences and the University of Novi Sad, and health sciences at the University of Pécs. His research focuses on mitochondrial health and nutritional interventions for chronic diseases. Dr. Ostojic has published over 320 peer-reviewed articles, authored 13 books, chapters, and holds 11 patents. He is an associate editor for the Clinical Nutrition, ESPEN, and Research in Sports Medicine, among others. He has received numerous prestigious research grants and is an active in international research networks such as WHO's European Childhood Obesity Surveillance Initiative and the Global Burden of Disease Project. Now, please welcome Professor Ostojic.
Ladies and gentlemen, dear friends and colleagues, I have a great pleasure to present my lecture at 2024 Molecular Hydrogen Summit. And before I start, I would like to thank Dr. Tyler LeBron from Molecular Hydrogen Institute and Southern Utah University, and Dr. John Kayer from Harvard Medical School, who are the co-chairs of this event, who invited me to give a lecture at this exciting hydrogen summit. The title of my lecture is Molecular Hydrogen as a Potential Modulator of Brain Metabolism. And I have an idea to present something we did in my lab in the past few years, trying to address what might be brain-specific mechanisms of hydrogen action in human studies in particular. So during the next 20 minutes or so, I'm going to give kind of background why we started this kind of research and give some updates and even some studies that has been and data that has been unpublished so far. I know that so many great speakers will address hydrogen in much more details than I do in terms of general science, but I would like to highlight two important papers that actually set out the scene for molecular hydrogen research community. And you could see here on this slide the cover page of the Science journal published back in 1975, when one of the most seminal research conducted by Dole and co-workers and the Baylor University actually suggested that hydrogen might be a very effective agent in treating cancer. The second cover is actually the cover of the issue of Nature Medicine, where probably the most cited paper in the hydrogen research published by Professor Ochtag back in 2007, addressing the possible role of hydrogen as a unique selective antioxidant. I also put a snippet of research ongoing or completed from clinicaltrials.gov regarding the hydrogen inhalation, specifically across various domains of health sciences and medicine, suggesting that actually something that has been found as a rather exotic agent becomes a very interesting and relevant biomedical agent in the past 2 decades. I think over 1,000 papers related to the possible use of molecular hydrogen in biomedicine has been published in the past 2 decades, and you could easily find so many interesting papers published in this year, searching PubMed and other relevant data bases. One of the domains that attracted the interest of research community in the past 2 decades has been the use of molecular hydrogen in neurology and neuroscience. And as far as I'm concerned, over 150 papers has been published in this domain, including various studies with human disease models in animal research, as well as human trials, and plenty of review papers. So I'm going to just give you a kind of short background regarding the effects of molecular hydrogen in human trials. You could see here a couple of first studies and very relevant and often cited studies regarding the use of hydrogen in neurology. And you could see here that the first studies actually tackled brain infarction or stroke, as well as some other conditions, particularly neurodegenerative diseases. Parkinson's disease paper published back in 2013 was one of the most commented papers in community. And most of these studies has been conducted in clinical patients, but some recent studies also address the use of molecular hydrogen in different conditions, not related to the pathology by itself, but regarding the changes in mood, anxiety, some biomarkers of the function of autonomous nervous system. And almost all of these studies suggested that patients improved their outcomes, suggesting that molecular hydrogen was safe and effective to improve different symptoms and signs of neurological conditions. However, recent studies try to better understand the molecular mechanism, or at least what appears to be the background of neurological or neurotropic effects of molecular hydrogen in human medicine. You could see here two interesting studies. One published just a few weeks ago in Japan, assessing the different patient-reported outcomes, as well as some biomarkers in patients with brain glioma who were exposed to 2 weeks of hydrogen inhalation. Besides finding some promising results in terms of improvement of clinical features of this complex condition, the researchers also find very interesting effects of hydrogen on E-cadherin, which is tumor suppressor gene, as well as plenty other biomarkers that has been regulated or modulated by the intervention of hydrogen, including the central nervous specific protein or glial fibrillary acidic protein. All these indicators of brain metabolism in brain cancer. Besides that, the recent study evaluating the mid-age healthy adults in Korea without any kind of cognition problems or Alzheimer's disease, the authors found that after 4 weeks of hydrogen inhalation, many biomarkers related to dementia, including the interleukin 6 or BDNF, actually improved after the treatment, trying to address what appears to be more molecular approach in terms of neuroscience and neurology after molecular hydrogen application. We already recognize that hydrogen is effective antioxidant, and these two studies confirmed this response. Still, we don't understand fully what happens in the brain when we administer molecular hydrogen. And basically, the specific protein or a gene that is the fundamental molecular target of molecular hydrogen still remains unknown. And also, a couple of studies recently suggested that it might be actually a different type of mechanisms when we administer hydrogen only in a single dose, comparing to a repeated and continuous administration for weeks or even months. Another set of evidence suggests that even the different routes of administration may induce different biological pathways. And in terms of genetic pathways of molecular hydrogen across the biomedicine, we already know that hydrogen can modulate the redox homeostasis. And there is a plenty of evidence about the effects of molecular hydrogen regarding signaling transduction or hormone adjustment all across the biomedicine, as well as the effects of hydrogen on specific aspects of mitochondrial function, particularly its bioenergetics. And the recent research suggested that uh, among newly identified pathways of molecular hydrogen action, it might be related to the upregulation of heme oxygenase activity. But for this presentation, I'm going to focus on something that appears more brain specific, related to the neurons. And perhaps we could recognize here two different types of action. One type of action related with the brain might be more direct, targeting the brain by itself. And another also brain related mechanism of action might be a kind of indirect effects that produce some molecules outside of the brain, particularly in the gut, that might be transferred to the brain and express its action inside the organ. So, through the next few slides, I'm going to talk about possibility that hydrogen might affect orexigenic and anorexigenic signaling in the brain. It might modulate the glutamate GABA pathway by prolonged administration of hydrogen. And we also focused in the past few years on understanding how hydrogen might affect different metabolites in the brain that are typically assessed with gold standard methods such as magnetic resonance spectroscopy, including the changes in brain choline, creatine, and acetyl aspartate. But also, I'm going to give just a short information about indirect effect that might produce some brain important brain specific action of short chain fatty acids produced elsewhere that might be transported to the brain and express it effects there, and that might be upregulated by the molecular hydrogen intake. Some time ago, I published hypothesis paper that actually hydrogen might be critically important in different appetite signaling by data collected from preclinical research. Actually, we have a pretty nice evidence so far that hydrogen might be uptaken by the brain and induce anorexigenic effects, meaning decreasing the food intake and increasing the energy expenditure. That might happen by the action of hydrogen on medial hypothalamus, where hydrogen might upregulate a couple of important molecules, including the pro-opiomelanocortin, serotonin, brain-derived neurotropic factor, and synaptophysin. All these molecules, all these bioactives can actually increase the energy expenditure and probably decrease the appetite and may produce that anorexigenic signals. On another side, there is a part of the brain that is posterior lateral hypothalamus, where hydrogen might induce and upregulate the level of melanin concentrating hormone and hypocretin, also known as orexin. These two molecules might actually increase the food intake and decrease the energy expenditure, which could be also supported by the gut related effect of hydrogen on upregulation of another orexigenic signal molecule, which is ghrelin. So basically, at the end of the day, this anorexigenic and orexigenic signaling might be affected by hydrogen, with probably anorexigenic signaling outcompete orexigenic signaling, inducing, at the end of the day, inducing the controlling the appetite in this part of the brain. And the preliminary data also suggests that these effects might be sex specific and age dependent, and definitely studies from the brain. This is probably very important for other aspects of brain related mechanisms of molecular hydrogen. Another set of the data that our lab produced recently is also related with the possibility that molecular hydrogen might affect appetite. This time, we evaluated the effects of hydrogen during the 12-week in overweight, 12-week time in overweight adults. Only 5 people has been recruited, but now we evaluated using the 1.5 Tesla magnetic resonance spectroscopy the level of glutamine, glutamate, and GABA. You already know that this is a critical excitatory inhibitory pathway in the brain, with glutamate the fundamental excitatory and GABA the fundamental inhibitory neurotransmitter in the brain. And we evaluated non-invasively the level of these molecules in 3 different brain regions, including the anterior and posterior cingulate gyrus, as well as the left prefrontal white matter. While the glutamine responses were not really impressive and couldn't drive any conclusions, we could see here a pretty solid evidence that the administration of glutamate, hydrogen, decreased the level of glutamate and also probably decrease or offset the levels of GABA across the brain. Since the GABA and glutamate are tightly related with appetite regulation, we concluded here that a possible hydrogen-driven upregulation of glutamine cycling that might attenuate the response of these chemicals in appetite stimulation might suggest that hydrogen through this brain-specific mechanism could lead to hunger suppression and weight loss. The third mechanism, or the third pathway, or a set of pathways that might be regulated and modulated by the effect of hydrogen on the brain, has been suggested by the plenty of studies we conducted in the past few years, evaluating the most important metabolites in the brain, including the choline, creatine, and acetyl aspartate. Either using the single dose hydrogen administration or prolonged administration that lasted for up to 6 weeks, we could see here that hydrogen might upregulate the level of choline across the brain, across different areas of brain, as well as upregulate the level of N-acetyl aspartate. Since the choline is the indicator of membrane viability, that might suggest that somehow hydrogen might support normal neural membrane turnover, while the N-acetyl aspartate is an indicator of mitochondrial function, suggesting that hydrogen might affect neuronal mitochondrial viability as well. But definitely there is something else that should be mentioned here. Although we give our best to evaluate the level of these molecules and metabolites across different areas of brain, you usually use 12 different locations. It's interesting that there is a difference between the single dose administration comparing to continuous or long-term administration. That is one important finding from our studies, as well as another one that hydrogen might affect different areas of brain in different manner. We also have an interesting study comparing whether caffeine, which is a well-known stimulator of brain function, is comparable to hydrogen in terms of metabolic footprint, and it appears there is plenty of differences, particularly when these agents are administered in a single dosage. So, although we really don't understand how molecular hydrogen affect choline or NAA viability and levels across the brain, definitely 3 studies published in the past few years suggest there is a metabolic footprint of molecular hydrogen for brain metabolism. The recent study we conducted in, again, overweight population after the 12-week intervention highlights something else that is not directly related with the brain, but is related with the level of short chain fatty acids, an important energy source for the human brain across the body. Here you could see the changes in three short chain fatty acid: acetic acid, propionic acid, and butyric acid, with the propionic acid and butyric acid upregulated after the intervention, comparing to placebo, suggesting that hydrogen might actually increase the level of these important biomolecules across the body. Theoretically, short chain fatty acid can be uptaken by the brain and maybe as used as an alternative energy source for the human brain. We already know that some neurodegenerative disorders are accompanied by the drop of energy metabolism in the brain. So theoretically, hydrogen might increase the level of these biomolecules in the brain and perhaps revive the hypometabolism in neurodegeneration by these components. Besides the effects of molecular hydrogen on different indices of brain function and metabolism, I just would like to give a short snippet of a study we conducted in my lab, which is not addressing exactly the mechanism of hydrogen action, but it's interesting study, actually a case study, when we administered hydrogen buccally to an athlete who suffered a mild brain injury. And the idea was to actually give a repeated intervention in hydrogen buccally, and monitored the change in the critical indicator of concussion assessment tool. You could see here that during the first 24 hours after the injury, the scores indicating the better condition of brain improved in this specific athlete that suffered a mild concussion. This suggests that besides typically used inhalation or oral administration, even the buccal administration of hydrogen might be helpful and should be considered in the future as a possible way how to address brain trauma or perhaps other brain conditions. Still, although these studies are promising and opening a new arena of research for molecular hydrogen neurology and neuroscience, there is a plenty of limits and many open questions that should be addressed in the future. We don't really have at this moment the standardized dosage regime to administer hydrogen in this domain. So there is a plenty of different intervention spanning from the single dose intervention, just one set, one dosage of hydrogen administered either as an inhalational through the inhalational route or as an oral administration, up to the 6-month intervention. And I already mentioned that it might be different if we administered hydrogen through different routes of administration. The dosage of hydrogen appears to be also something that is not clearly addressed at this moment. So you could see a really different concentration of hydrogen in oral products from 0.5 ppm to up to 12 ppm. And also the inhalational hydrogen is very different, ranges from 2 to 56%. There is, at this moment, there is no appropriate dose response trials, and a long-term safety has not been established yet. Most of the studies in the area of neurology and neuroscience suffers from inferior quality, including the small sample size, often using no placebo, applying and embracing the open label approach, and very few studies are really randomized control trials. We always have to consider the fact that probably the effects might be different comparing healthy subjects versus the patients. And something that is even more important, we don't have enough objective measures of biomarkers. So often studies are only conducting evaluating the patient reported outcomes, which is extremely important, but Some additional molecular lab assays, including the magnetic resonance spectroscopy, might help us, or functional MRI might help us to understand what is really behind the scene when molecular hydrogen enters and tackles the brain. I am really excited to see that some area of research that I'm really interested in, long COVID, which is basically a neurological disease, is also going to be addressed by hydrogen. Soon, the Oxford Brookes University started a study evaluating the effects of hydrogen inhalation in this perplexing condition. So hopefully, we are going to see soon the results of this studies that research community of molecular hydrogen waits with a great excitement. So let's conclude this short presentation here just to give a kind of few important take-home messages, including the fact that we definitely have a positive opinion in terms of hydrogen being a novel neurotropic medical gas with therapeutical potential demonstrated across of different conditions, from neurodegenerative disorders and stroke to traumatic brain injury and cancer, but also expanding to healthy population as well. Still, we don't understand what is the molecular target of hydrogen, but our lab and some other labs across the world suggest that it might have a brain-specific action that might involve anorexigenic signaling, GABA glutamate pathway modulation, but also some additional mechanisms that involve specific metabolites, including the choline or and acetyl aspartate. Definitely, we need better studies that are randomized, controlled, long term, and that involve some mechanistic approaches to elucidate really the brain specific mechanisms of these smallest but so exciting molecules across different domains in the area of neurology and neuroscience. At the end, I would like to thank all my colleagues and co-workers, particularly from the Applied Bioenergetics Lab, but also through the University of Agder in Norway and the University of Pécs in Hungary. I worked with those guys for many years in different domains of biomedical science, trying to better understand what molecular hydrogen can provide as an innovative agent. But not only these guys, many people all across the world support my research and help me and co-authored our papers in this new area of research. And I would like also to thank the grantors and industry who provide us an opportunity to address both the fundamental aspects of hydrogen, its physiology and pathophysiology on one side, and on other side, what the application of different hydrogen interventions might have in the areas of biomedicine. So thank you for your attention, and feel free to approach me with any comments, questions, or other issues via email. Thank you.